Great. I'm going to go ahead and get started. Thank you all for being here today. Again, this is the FPF summer webinar for the pre-health sciences. In this webinar, we cannot hear or see you. So if you need to take a break, if you need to go grab a snack, if you're laying in bed, we won't be able to hear or see anything. So that's totally all fine. For any times you have any questions, please use the Q&A function. It looks like two little dialogue bubbles. So feel free to click on that if you have any questions throughout the presentation. We will be getting them at the end of the presentation during the Q&A portion of this webinar. So again, thank you again for being here, and I'm going to go ahead and start with introductions. So my name is Brandon Castillo-Basa. I'm one of the FPF academic advisors. I previously was a UC Berkeley student. I came in as MCB. I was pre-med. I took all the pre-med classes. I didn't end up going to medical school because I changed my mind my senior year, but I do have some experiences with the classes and doing some research and also volunteering at the hospital. So that's sort of why I'm leading the webinar. And Tanvi, would you like to introduce yourself?
Yeah. Hi, I'm Tanvi. I'm an incoming third year at UC Berkeley, and I was in FPF for my freshman year, first semester. I recently declared as an MCB major with an immunology emphasis, so I finished all the major prerequisites and pre-med prerequisites. So.
Okay. Thank you, Tanvi. So what is pre-health, right? So oftentimes when we think about pre-health, oftentimes the first thing we think about is pre-med and thinking about medical school. But outside of medical school and becoming a physician, there's so many other ways in which you can get involved within the healthcare system. So these are just some examples of ways in which you can get involved within healthcare. So if you're interested in becoming a dentist or optometrist, ophthalmologist, if you want to go into physical therapy, veterinary, working with animals, right? Physician's assistant, even just public health, right? So there's so many different ways in which you can go into healthcare. So I also just want you all to think about, how you want to get involved and what are all the types of jobs and opportunities out there that sort of fit you and sort of what you want to do. And in the chat, Tomby put in some great links regarding medical school as well as other pre-health professional schools. So definitely check that out because that goes into a lot more in-depth information about the process of applying, as well as just understanding what are the differences between some of these different pre-health occupations. And just as a reminder, in terms of the summer timeline for you all should be working on your Golden Bear advising. If you haven't gotten started on that, please do so as soon as you can. As soon as you complete your Golden Bear advising, that's when you're able to schedule an appointment with your FPF advisor, and that's where we'll sort of discuss your fall schedule and also just answer any questions with you via Zoom. And the reason why it's important to complete Golden Bear advising with your advisor is to prepare for phase 1 of enrollment, which begins on July 13th. That's when you actually will enroll in your classes yourself. So definitely be prepared for that coming up in just about a month. Phase 2 will begin on August 13th. That's when you can add more classes to your schedule. And then August 14th is adjustment period. And we'll definitely go over some of the different enrollment periods coming up as well later in the slides. So in terms of the requirements that you had to really think about, I sort of like to think about it in 3 different areas. The first area would be your major requirements. So whatever major you decide, there are certain requirements that you have to satisfy. That is one set of courses that you'll have to complete. The second area would be your letters and science college requirements, right? So that's what's listed here on this slide. These requirements are sort of like general education requirements. So that includes essential skills, UC requirements, the 7-course breadth, as well as the American cultures requirement. And sort of the last area that you want to consider would be the pre-health prerequisites, right? So if you're considering medical school, what are the medical school prerequisites? If you're thinking about pharmacy school, what are the pharmacy prerequisites, right? So when you're thinking about those 3 areas and you're thinking about what classes to take, what is the most efficient way of creating a schedule? And when we're thinking about classes that sort of fit within all 3, that sort of makes it easier in a sense that you're not taking too many classes and you can fit everything that you need. So for example, if you are a student majoring MCB, thinking about medical school, if you were to take a class like Biology 1A, that sort of fits in all three areas, right? So biology 1A is an MCB requirement. It also satisfies the biological sciences breadth, and it also is a pre-med requirement. So when I'm thinking about pre-health sciences and the pre-health prerequisites, oftentimes the three areas, breadth areas that will be satisfied by different bio or science majors, as well as the pre-health prerequisites. Most of the time, biological sciences, physical sciences, and social and behavioral sciences will be satisfied by those requirements. So outside of your major and outside of the pre-health prerequisites, you sort of want to focus on taking classes outside of that because those classes will not be satisfied by your major or by the pre-med requirements, for example. Like for instance, you're not going to have a historical science class within MCB or within the pre-med requirements, right? So when you're sort of formulating your schedule, you sort of want to sort of create the most efficient schedule and sort of keeping in mind, what are the ways in which you are satisfying classes and how can you make it as efficient as possible. In the chat is a list of the degree requirements, so everything that's listed on here. If you want to get into more detail, some of these things you may have already satisfied with high school coursework or high school credit exam, so definitely take a look at that if you haven't done so already. So in terms of creating a balanced schedule, this is sort of the way that I like to think about it. You want to take 1 to 2 major prerequisites, just so you can get started on one, deciding if you want to major in that, and 2, just getting started on the major requirements in case there are a lot. The next thing you want to sort of consider is if you are thinking about an alternate major or a backup major, definitely consider what are the prerequisites for that as well. If you haven't done so already, definitely take reading composition. This reading composition requirement, you have to complete that by the end of your sophomore year, so by your 4th semester. So getting started on that as soon as possible is really important. The next sort of class you want to consider would be either a breadth or an elective. And then again, in terms of overall unit count, the minimum you need to be a full-time student is 13 units, unless of course you have a reduced course load. And the max you can take at FPF your first semester is 17.5. And the reason why we have 17.5 is we found that students who take more than that tend to not do so well and end up on academic probation. So that's why we have that cap, is to really protect you from not overloading yourself in terms of courses. I think a really sweet spot for having a balanced schedule would be closer to around 14, give or take 1 or 2 units. I would probably suggest taking about that in terms of your first semester here at Cal. Tanvi, what was your first semester schedule when you're in FPF?
Yeah, so as an MCB major, my schedule for the first semester freshman year included Math 10A, which was a major prerequisite, an R1A class, which fulfilled like the part 1 of the reading and composition requirement. And then I also took Sociology 3AC, which fulfilled the American Cultures requirement, and then Psych 2, which fulfilled the Social Behavioral Sciences breadth requirement. And these added up to, I think, 15 units. And then I took Sociology and Psych because I knew like they would also be later like important for the MCAT, so I included those 2 as well. And then I thought this was like a good balance for me because it gave me like time to like adjust to being in a new environment. And then I also just took a 1 unit like decal on the main campus called Pre-Med 101, which was just very low effort and gave me like a good intro and just like some tips to being pre-med at Berkeley during that semester.
Yeah, thank you for sharing your schedule. And that is a very typical first semester schedule for a lot of students, both in FPF and students not in FPF. Is really a math class, a reading class, and then 2 electives. Oftentimes that elective is psych or soc, just because it's something that is often recommended for a lot of different pre-health graduate schools, including medical school and for the MCAT. So yeah, that is a very typical schedule that a lot of students have. So thank you for sharing. And I think when you're considering balance, and this is something not just for your first semester, but also just for your entire time at Cal, you really want to just consider balance in general, right? So when considering classes, you don't want to take too many classes that are reading and writing intensive. On a very similar note, you don't want to take too many math and science classes where you're overloaded with like a lot of different labs, or you're just taking a lot of classes that are difficult in general. You also want to consider like papers and project versus exams, right? So Oftentimes, when you're taking a lot of science classes, you have like 3 or 4 finals, and sometimes that can be a lot. So if you can somehow add an elective where instead of an exam, it's a paper or a project, that makes it a little bit easier. Sometimes that can make balance a lot more manageable as well. And just in general, like, outside of like your pre-health courses or your major courses, you will have space to add other classes that are outside of those academic areas. So, choose classes that are also fun and exciting for you, right? Like Tanvi took a pre-med class to sort of get more knowledge on what pre-med is going to be like. And I'm sure like because it was a decal, it was 1 unit, it wasn't like too stressful, and it just allowed her to explore this career area that she's excited, that she wants to know more about. So, take classes that are fun, take classes that are exciting for you, and just in general, just keep your overall units in mind. If you're worried about like what your course load is, like take less units now, and if you feel like it was okay and you want to take more, next semester take more units. And if you find you take more units and it was a little bit too much, then adjust and take less units the next semester. So there's always ways in which you can sort of adjust and really figure out for yourself like what is a right unit amount for you. And of course that can change by each semester depending what classes you take. Maybe you're not so great at math, so maybe you'll take a little bit less units that semester, or maybe you're really good at math, but maybe you're not so great in like biology or chemistry, and so maybe you still keep it lighter, right? So definitely keep in mind your strengths and how you can have a balanced schedule in that sense. Tommy, I did want to ask you, outside of like the pre-med and MCB classes, like what are other classes you took that were just really fun and maybe outside of those academic areas?
I haven't taken too many so far because I'm trying to get my like pre-med requirements out of the way, but I took like a couple like really nice breadth classes that I really enjoyed. Like I remember I think this past semester I took like a class that compared like education in Europe versus like in America, and I thought that was really interesting because I had no experience or like knowledge of like how education was in other parts of the world, so it was really interesting to see like how different it was. So I really liked that class, and then I took a class on like the history of science, which I thought was interesting. So I think those 2 classes I like really enjoyed.
Yeah, thank you for sharing that. And again, like part of being an LNS is also just getting a diverse academic education, right? So taking classes in other areas is something that you have to do, but also like choose breadth classes that are fun and will allow you to just learn something that you may be interested in.
Yeah, I would also say like even for like reading requirements, things like that, like there's so many different like classes. So I would say like take something that like you think is actually like really interesting. Cause I remember for my reading requirement for one of them, I took a class on like eco doc. So we basically spent like a lot of our homework was just watching like environmental documentaries on Netflix pretty much. So I thought that was really fun too.
Yeah. So yeah, that's a really great reminder. When you are considering your reading composition, remember that each of the classes that we offer in FPF, they are taught by different instructors, and those instructors will utilize different materials, books, documentaries, films, etc., to sort of teach the class. And so what you're writing about can be different compared to another class, right? So when you're looking at reading composition courses, definitely take a look at the description and the topic. You can definitely find all that in the Berkeley Academic Guide when you're looking for classes. Great. And then in terms of priority, when you're thinking about which class you should enroll in during phase 1 versus phase 2, because again, during phase 1, you're capped at 13.5. So if you have a schedule that amounts to 16 units, you'll most likely only enroll in 3 of them, and you enroll in the last one during phase 2. So that means you will have to sort of prioritize which classes you want to get into first. So this is sort of the way that I would prioritize it is 1, where the major prerequisites that you sort of want or have to take in order to just, make sure you're not falling behind. 2, I would prioritize reading composition. They are smaller class sizes. Most students, regardless of major, will need to take a reading composition. So those tend to be popular and tend to fill up fairly quickly. The next thing to prioritize is just the breadth or other LNS degree college requirements. And then the last thing to prioritize would be your electives or enrichment. So yeah, just really keep all this in mind in terms of the unit amount, and just be prepared to sort of prioritize and have to give and take, which one would you rather risk not getting into and enroll in that during phase 2. And I did want to sort of go over the FPF specific policies regarding the allowed classes by phase. So just as a reminder, during phase 1 and phase 2, again, you're capped at 13.5 units. And during these two phases, you're allowed to enroll in classes from the FPF curriculum. So again, those will be classes with the X prefix. And then anything outside the curriculum, if it's 2 or less units, those are all classes you can consider. The only 2 or less unit class outside of our curriculum that you would not be able to take would be classes with prerequisites that you haven't met yet, and then freshman and sophomore seminars. And the reason why you can't take freshman, sophomore seminars is that Berkeley wants to reserve those seats for students that don't get the opportunity to be in smaller class sizes. And since you're in FPF and all your classes are relatively small, they just wanted to reserve those seats for students that won't have that opportunity. And then during adjustment period, pretty much the same thing, but now the difference is you're able to enroll in a class outside of our curriculum that is 3 or more units, that is lower division. So for example, if you wanted to try to enroll in Chem 1A or Bio 1B, that is a class that you can enroll in during adjustment period. So if you have any questions about the enrollment periods or just need more clarification, feel free to reach out to your FPF advisor and we can definitely clarify this for you further. Great. Tanvi, did you want to mention anything about how you prioritize your classes when you enrolled in FPF?
Yeah, I enrolled in my RNC class. I definitely recommend doing the reading and composition in your phase 1 itself. And then I also enrolled in my math class and my sociology class in phase 1. And then I took Psych 2 outside of FPF on the main campus. So I just did that during phase 2 because it was like an elective anyway.
Great. Thank you so much for that. And then one thing I want you to consider is, what is the appropriate English and math course for you, right? So in terms of English, depending on if you have any AP scores or any community college courses, you definitely want to consider which one is appropriate for you. If you haven't done GBA, definitely read through that because that goes over how to select the proper English course for yourself. I also want to mention that some pre-health schools require 2 semesters of an English, right? So for example, medical school, they require 2 semesters of English. So even if you test out of say English R1A and entry level writing, some students will still go back and take English R1A to ensure that they complete the 2 semesters of English for medical school. If you decide, like say for example, you're not 100% sure about medical school and you decide to sort of go straight into English R1B, that would just mean you'll have to find another English class in the future that would still allow you to satisfy the pre-health requirement. So sometimes that can be a little bit more difficult just because you want to make sure you are taking a course that is writing intensive and will satisfy the pre-health requirement. So sort of if you do get to that point, just make sure that you are reaching out to pre-health advisors and figuring out what is a proper English class that will satisfy that still. So, keep that in mind. And if you are for sure, you are definitely wanting to do one of the pre-health schools that require 2 semesters of English, you may just consider, even if you tested out of it, going into reading composition part A, just to ensure that you have satisfied that and you're choosing the proper class. In terms of math courses, you definitely want to consider the major. Some majors accept certain maths, some majors don't. Like for example, MCB and IB, or molecular and cellular biology and integrated biology, they don't accept math 16A, right? So you definitely want to consider which math makes the most sense. So when you're thinking about your major or majors, take a look at all the ones you're considering, including backup majors, and see what maths overlap. And from there, you can sort of decide what math makes the most sense. I would say a lot of students will take math 1A and 1B just because that's the most diverse and accepted between all majors. It is pure calculus. Math 10A is a mixture of both calculus and statistics. So this one can be difficult for students just because it is a bit faster paced in a sense that it includes both calculus and statistics. So if you don't have experience in either of those subjects, it can be difficult for some students. So just wanted to keep that in mind. But it is sort of recommended for science courses or for science majors like MCB and IB. They do suggest Math 10A. And for medical school specifically, it's nice to have just because it goes over both calculus and statistics, so you wouldn't have to take an extra statistics class in that sense. Math 16A is known, is more analytical geometry and calculus. It is also 3 units, so that is another math class to consider. Some students find that class a bit more manageable compared to Math 1A, so that's another class to consider. I believe public health is one of the science majors that allows Math 16A, so if whatever major you are considering, just please double check that is accepted by your major. And if you haven't had any calculus sort of experience yet, and you need to take calculus in the future, definitely consider taking Math 32, which is pre-calculus. This is to help prepare you so that you have the proper foundation to do well in the future calculus course that you will take. So it's totally fine if you start off with Math 32. I know a lot of students start off with Math 32, still declare and graduate within their timeline. So not to worry in terms of like if you're worried about like falling behind. There's a lot of students that end up taking Math 32 and will still declare and graduate in a timely manner. So definitely don't worry too much about that. Stats 2. So for a lot of schools, they require at least 1 semester of math and 1 semester of statistics. So if you go into a major that doesn't require 2 semesters of calculus, that's another route you can take, is by taking, say, Math 1A and Stats 2. And for a lot of pre-health schools, that would satisfy the math requirement for that. And if you're having trouble with determining which math you want to take, reach out to your FPF advisor. We can send you some resources regarding how you can decide which math makes the most sense for you. And here is a list of different biological science majors within the College of Letters and Science and the College of Natural Resources. There are other colleges like the College of Chemistry or even the College of Engineering in which there are biological or physical science majors that could definitely work. I'm only listing College of Letters and Science, College of Natural Resources, just because 1, you're in the College of Letters and Science, and then 2, it is a bit easier for students to get to switch into the College of Natural Resources compared to the other colleges I had mentioned earlier. So these are just some examples. And the reason why it might be nice to select a biological science major is that a lot of the major prerequisites overlap with the pre-health prerequisites. Like for example, MCB requirements and IB requirements pretty much are the pre-med requirements, right? So as long as you're keeping up with the major requirements, you will also keep up with the pre-med requirements, for example. So if you want to see a list of those different biology majors here at Cal, Tommy put a link in the chat, so definitely check that out. But again, depending on the pre-health school that you're thinking about, oftentimes there is no preferred major, right? So like if there's another major you're thinking about, like for example, if you wanted to major in English, you can definitely do that as long as you're also still satisfying the pre-health prerequisites. Again, this often does differentiate depending on what pre-health sort of route you're considering. But for the most part, as long as you're completing the requirements, regardless of your major, that is totally fine. Like for example, when I was pre-med, I was majoring in ethnic studies, and that would totally have been fine as long as I had completed the pre-med requirements. So if majoring in a biological science is something you do not want to do, that is totally okay. So just wanted to put that out there as well. And just some other sort of things to know about health professional schools. If you've taken like high school courses or exams, oftentimes that will not satisfy different prerequisites. So if you've taken like AP Bio and you got a 5 on that, medical schools will not accept AP exams in that sense. So you will want to make sure that you are taking a college level course to satisfy the different pre-health school prerequisites. You can take classes at the community college, though it is recommended during your time at UC Berkeley that you take your prerequisites at UC Berkeley. There are some cases in which you're taking community college class over the summer, where maybe it's a breath class, and that's fine, and that's okay. Or maybe perhaps you decide to go into pre-med later, and you decide that you still need some pre-med classes, and you end up taking at the community college. That's fine since you've already graduated from UC Berkeley. But for the most part, during your time at Cal, if you're able to sort of take all your pre-health school prerequisites here at Cal, that is most recommended. If you are thinking about study abroad, definitely sort of check with the study abroad office if the class you're taking will sort of satisfy the pre-health sort of prerequisite. Oftentimes, because it is from another country, it may not sort of be equivalent to the UC Berkeley version of the course. There are some exceptions, like I know that there is a UK summer program where you take physics, and that is accepted by a lot of different medical schools. So just if you are thinking about study abroad and you're thinking about taking a pre-health prerequisite there, just double check with the study abroad office that it is accepted by the pre-health school. And then if you are taking a prerequisite for a health professional school, make sure you're taking that class for letter grade and not pass, no pass. They would, oftentimes they do require for letter grade, except for special instances. Like for example, there's a time during COVID where they were allowing pass, no pass. But obviously that you can't necessarily bank on that. So anytime you are taking a prerequisite for your health professional school, please make sure you are taking it for letter grade. Also for a lot of majors, you have to take it for letter grade anyways. So just be sure that you are taking the correct grading option for that. And in the chat, Tommy put in some just information again about medical school and health professional grad school. So definitely review those links as well. And then I did want to just quickly go over the medical school requirements. A lot of the other health professional schools have something similar. Sometimes they have a couple more classes, maybe 1 or 2 less classes, but generally this is what it will look like for medical school, especially since the majority of students who are interested in pre-health are thinking about medical school. I just want to go over this really quickly. So it'd be 4 semesters of chemistry with lab, 2 semesters of biology with lab, 2 semesters of physics with lab, 1 semester of math, 1 semester of statistics, 2 semesters of English. And there are some medical schools that require behavioral and social sciences, such as psychology or sociology. Even if the medical school does not require it, taking it is important, just so you have some knowledge required for the MCAT. So that'll be helpful in that sense. Especially if you are considering taking the MCAT, completing some of these requirements may be useful, just so you have all the information and knowledge for the MCAT. Say you're taking the MCAT and you haven't taken, say, like biochemistry yet. It may be a little bit more difficult having to study material that you haven't learned yet on your own. So that is definitely something to consider in terms of your timeline. Tanvi, was there anything you wanted to mention about the medical school prerequisites?
Yeah, I put a link in the chat, and I referred to like that website when I was making choices about how I wanted to organize my classes and like what classes I wanted to take. For the 4 semesters of chemistry with lab, I feel like it was a little different for Berkeley, because I know usually med schools say they want like a full year of inorganic chemistry, but with Berkeley, just taking Chem 1A and the lab with that was like enough for a full year. So that 1 semester of Chem 1A was enough to fulfill like the 1 year of inorganic chemistry requirement, which I found out through one of my advisors.
Yeah, exactly. So just to sort of reiterate that would mean you would not have to take Chem 1B, unless of course you change into the College of Chemistry, which certain majors require Chemistry 1B. But for the purposes of medical school, Tanvi is right. Like you can sort of follow the Chem 1A, Chem 1AL, and that would sort of complete the inorganic chemistry series. And then you would just take Chem 3A, 3AL, Chem 3B, 3BL, and MCB 102, and that would sort of satisfy the 4 semesters of chemistry at Berkeley. And all medical schools know that about UC Berkeley, so you wouldn't necessarily have to sort of explain that for the most part. So definitely no worries in that sense. And I also just wanted to go over some medical school myths that oftentimes students are worried about. One of the major myths is taking a gap year. Like taking a gap year is going to be bad for you. Taking a gap year doesn't look good. And actually taking a gap year is okay. You know, over 3/4 of applicants actually take at least 1 gap year, and many students take more than 1 gap year, and that's totally fine. So I think in terms of a gap year, you know, sometimes taking a gap year is preferred just because it gives you an opportunity to do more with your application, right? So maybe there's another class you want to take to increase your GPA, or maybe there's just more science class that you still need. Maybe you want to work at a hospital or do more research and just do more with your application to just strengthen everything for when you do apply to medical school or other health professional schools. Other health professional schools often sometimes require a certain amount of hours to complete. Like for example, if you're thinking about physician assistant school, oftentimes they require, I believe, 2,000 to 4,000 hours of like clinical experience. And obviously when you're at Cal, that may be kind of difficult because you're a full-time student. So oftentimes students will take a gap year or 2 gap years to sort of complete the clinical hours and get clinical experience. I think one thing in general that you want to consider is that the application process for medical school and a lot of other schools can take a year, right? So when you apply, the interviews, when you have to take your MCAT, all that takes a lot of time. So really having a gap year can often give you just more time to be able to focus on what you need to focus on, whether that's focusing on the MCAT, whether that's focusing on getting more experience, or just applying, right? Like writing personal statement essays and doing all these things for your application takes a lot of time. So sometimes taking a gap year can be helpful in that sense. As I mentioned before, there's not necessarily preference for majors. I believe there's a statistic where it was about 50-50 where they had a biology major or not a biology major for students that were admitted into med school. So again, like choose a major that you want for yourself and that makes sense for you. Yeah, those are just 2 myths that I want you all to consider. But yeah, Tanvi, was there anything about this that you wanted to speak on?
Yeah, I came in like thinking that I wasn't going to take a gap year because I wasn't really like informed about like how long applying takes and things like that. But I like decided that I'm planning on taking a gap year also just to give myself like more time to spend like even during my junior and senior year, so I don't have to like spend it doing the application, but instead like actually like having more experiences. And many people take gap years for like different reasons. Like some people will do like a master's program or things like that. I'm thinking about just working part-time as like a phlebotomist. I recently took a course on that just to like, it's basically the people who draw your blood and then just like continuing to do research and then using that time to apply instead of doing it during my senior year.
Yeah, so Tanvi is a great example of why a gap year could be good for you, right? And just in general, like a gap year can also be a time for you to rest, right? So sometimes maybe you just want to take a break from school just for a little bit, and that's totally fine as well. But you do want to like keep the gap year somewhat productive and showcase something that you're doing as well. But yeah, just if you are considering a gap year or multiple gap years, just consider what your timeline looks like. And if you need a little bit extra support on sort of figuring out that timeline, feel free to reach out to your FPF advisor or one of the pre-health advisors. And I'll go over some of the other types of advisors and resources later on as well. So here's just an example of a 4-year schedule with a gap year catered to FPF students. This is coming from the Berkeley Career Center's medical school page. So, and this only includes majority of the medical school requirements. So if you are considering like creating a 4-year plan or need support creating a 4-year plan for your specific pre-health school, which includes a gap year, or maybe it doesn't include a gap year, definitely reach out to your advisor. We can help you sort of formulate a schedule that makes sense. But as you can sort of see here with the sample 4-year plan, this student completed all of these sort of classes necessary for the MCAT, like the material for the MCAT at the end of their junior year. And during the summer, they plan on taking the MCAT. And then they have a full year of either working on their application / maybe retaking the MCAT. Because again, maybe you take the MCAT, but you need more time because you have to retake it. So that's something that you want to consider as well is, do you want to have a buffer if you need to retake it just in case? And then at the end of the senior year, that's when they would apply and they would start the fall after graduating, right? So again, it is about a year sort of wait, and that's okay, right? So definitely consider your timeline and when you want to take the MCAT and when you want to apply. In terms of course combinations, I think this is also another important thing to consider. So here are some things that you don't want to do, right? Don't take too many science classes per semester. Like if you're taking 3 or 4 science classes, that's going to be a lot and may not be the best. Avoid taking prerequisite courses, pass, no pass. Again, you want to take them for letter grade. And if you can, like if you're not majoring in something that requires advanced sequences, it is not necessary for you to take the harder version of the course sequences for different pre-health schools. Like for example, instead of taking Chem 1A, like you do not need to take Chem 4A. It's just going to be more difficult and there's going to be a higher likelihood of you maybe not getting as high of a grade. Very similar to like Physics 7A, stick to Physics 8A unless of course you're in a major that requires Physics 7A. And really the whole purpose of the of not avoiding advanced sequences and avoiding taking too many science classes is that you want to be able to do well in all your classes, right? While grades aren't the only thing in medical school, it is having a good GPA will get your foot in the door and will allow you to have more opportunities for all these different pre-health schools. So, you know, being able to spread out your classes during your time at Cal and taking classes that are required and not taking classes that are too difficult for you is really the best route to take in order for you to have the best opportunity and chance to get a strong GPA and do well in the classes. And just in general, right, when you're considering classes, know your strengths, know what works for you. And that's why, you know, during your first year, it's really important for you to just get acclimated and not do too much and really figure out for you, you know, what does a balanced schedule look like for you and what are your strengths and things like that. And of course, talk to students and talk to advisors and major advisors, get their sense of what their schedules were and what did they take and how did they formulate their schedules, because it's really important to just get a student perspective on things and to give you a sense of what you can do as well. Tommy, did you have any recommendations for this?
Yeah, I would definitely like recommend not taking more than 2 classes per semester. I tried doing 3 science more than 2 science classes per semester. I tried doing 3 science classes one semester and felt like it wasn't really worth it, and I wasn't able to like put the effort that I wanted to in each class. So I wish like I spent that time instead trying to get more involved in like extracurriculars, especially during my freshman year. And I thought that would have been a better use of my time than trying to take 3 science classes in one semester. And then I would also recommend within those 2 science classes, try not to take 2 classes that have that lab course attached to it. Like don't take Chem 3A with Bio 1A because that's just way too much work. I'd recommend instead taking like one of those classes with like a physics class instead.
Yeah, that is another great recommendation, right? Like if you're having 2 labs or 2 separate labs in the same semester, sometimes that can be a lot. And again, like it's not just academics that they're looking at. Last time we mentioned, like there are also experiences and getting involved. So that's also equally as important during your time at Cal. Great. And again, just to reiterate, for medical schools and other health professional schools, all prerequisites must be taken for letter grade. Do not take it for pass in the past. And if you do end up doing that, you may need to take another class to sort of satisfy whatever prerequisite it is. Within LNS, no more than 1/3 of your graduation units can be taken pass no pass. So for example, to graduate with an LNS, you need at least 120 units to graduate. So do not take more than 40 units pass no pass. And 40 units pass no pass is kind of a lot. And I would only really strictly use pass no pass for classes that are outside your major. So maybe for breath, or maybe it's your elective, like 1 or 2 unit electives that are pass no pass, that's totally fine. But if you are planning on taking a prerequisite pass to pass, just be sure to reach out to an advisor first before you make that final decision. And outside of your FPF advisor, if you just need more support with just pre-health advising, here are 2 resources that I think are really, really important and crucial. So LNS, so that's the college you're in and the advice that you will be using a lot more during the spring semester. They have pre-professional graduate programs where they support students thinking about pre-health schools. So the 2 advisors, Tim Cahill and Greg Sarah, they're amazing. They know so much. They have a lot more resources. So definitely, you know, if you are thinking about health professional schools, consider utilizing them as a resource. They do individual advising. They have advising sessions. They also just have other types of workshops and events. So definitely take a look at that as well. And Tomby put a link to that in the chat. So definitely review that when you get the chance. The Career Center is also a really amazing resource outside of just their website that has a lot of information that you need to know. They also provide advising, right? So pre-health advising services include new student advising, which is really for transfer students, as well as sophomore students and above. And once you are a sophomore, you can do more intentional, like 30-minute advising appointments. So for first-year students, really the way in which you can get pre-health advising services is through drop-in advising. So for you, if you want to reach out to the Career Center, I would advise you to do the drop-in advising, or you can email them your questions, right? So email is another way of getting a lot of useful information. So definitely reach out to them via email as well. I would also suggest that you sign up for the pre-health career mail listserv on Handshake. This is really useful because it'll just send you information on opportunities like internships or job opportunities, maybe research opportunities, and it goes straight to your inbox, right? So definitely sign up for that if you haven't done so already, because that'll be really useful in that sense too. And again, Tanvi put that information in the chat, so definitely take a look at that as well. Great, so another big portion or a big aspect of pre-health professional schools is just research and clinical experience, right? So here at UC Berkeley, some of the common ones would be URAP, so Undergraduate Research Apprentice Program. The Vice Chancellor for Research page also has a lot of information about different research opportunities. There is the Summer Undergraduate Research Fellowship. So if you don't have the opportunity to do research during the fall or spring semester, over the summer, you can definitely still do some research as well. Another way to sort of get research and clinical experience is just through networking. So if you have, if you connect with a GSI professor and you're working with them and you like the course itself and they like you, sometimes you can get research opportunities just from that. So I highly suggest always connecting with them and seeing what kind of opportunities you can get from that. So outside of Berkeley, so near Berkeley, but it's off campus, some things to consider would be UCSF. So actually, when I was a student, I volunteered at the UCSF Children's Hospital, or it was the pediatric portion of the hospital. So I got to work in pediatrics and got to work with a lot of the youth and the pediatricians there. So that was a really cool experience. There's also the Children's Hospital Oakland Research Institute, so CORI. So that's another one that a lot of students at Berkeley sort of get involved in. They also have a summer research program as well, so that's something you might want to get into. There's also just a lot of other hospitals and clinics that you can sort of get involved in, whether that's Alta Bates. There's also the Berkeley Free Clinic. So there's a lot of different hospitals in which you can volunteer and also get some experience as well. But definitely check out the research.berkeley.edu link that's in the chat. That has a list of all the different sort of research opportunities. And if you're just sort of wondering what are the other types of clinical experiences, definitely reach out or sort of just honestly go on Google Maps and search up hospitals and see what's out there and reach out to them and see what kind of opportunities they have as well. But definitely reach out to your FPF advisor and ask them about some of the different opportunities because there's definitely a lot in and outside of Berkeley. Tanvi, how about you? What kind of research or clinical experiences have you had so far?
Yeah, so research-wise, I applied to Europe my freshman year, and I was a part of Europe from my spring semester freshman year through the rest of the year till my fall semester of sophomore year. And I really enjoyed, that was my first introduction to research at Berkeley. And I worked with Dr. Bertozzi, who is a public health professor here at Berkeley, and we did a lot of COVID-19 research. But it was mostly dry research, and I wanted to get more experience with different types of research. So I looked for opportunities for wet lab research, which is when I got involved with CORI, which is the Children's Hospital Oakland Research Institute. And I just got that basically through cold emailing. And so yeah, currently I still work at that lab. I started this past semester and I'm still there this summer, and I work at the Medina lab where we basically work on fatty liver disease. So that's what I've been a part of so far. And then clinical opportunities, when I first came, a lot of things were still closed because of COVID, but I think a lot of opportunities are opening up now. So I volunteer at the Alta Bates Hospital in Berkeley, and it's just like a 10-minute bus ride away, which I found was very convenient. So I volunteer at the emergency department in that hospital right now. And then I also just wanted to add a link from the Career Center of like some like volunteer opportunities that they had in that website, and that's how I found out about this one. So I thought that could be helpful.
Awesome. Thank you for sharing that link. That is great. Yeah, like so as you can see, like Tanvi has been involved in a lot of different types of research and clinical experiences. And I think the more that you do research and the more that you get involved in the clinic, the more sure you can be about sort of your future path in terms of the pre-health school that you want to pursue or the occupation that you want to pursue. Oftentimes when you're in the classroom, you don't necessarily get a sense of like, oh yeah, this makes me want to become a doctor, because maybe you're just studying like plants, for example, like bio and B, right? Maybe that's not going to tell you if you want to become a doctor. But when you're doing research and you're working with professors and doctors, and when you're in the clinic actually working with different patients and supporting and seeing it live, that will sort of give you a better sense of, yes, this is what I want to do in the future, right? So that's another reason why I highly suggest it, not only because it's good for your application, but also because it'll, make sure that this is something you want to do, because all the different health professional schools are a big investment, right? Oftentimes they're 4 years, they're expensive. So if you really want to do it, you want to make sure that this is something that you're passionate about and that you're sure about it.
Yeah, I would definitely recommend like being persistent, even if you don't end up getting into a program that you apply to. Like keep looking for opportunities. And I would also say if you're doing something that you're not interested in, definitely like try to look for something else, because it'll only be like meaningful to you if you're actually like interested in what you're doing.
Yes, exactly. And again, like especially when you are applying and you go through interviews, they can often tell if like you are actually passionate about the experience that you've had. So definitely get involved in things that you are passionate about, even if it's not necessarily like research or clinical. Like, for example, maybe you're passionate about recruitment and retention and working with high school students and within higher education. Like if that's something you're passionate about, that is definitely something you can still put on your application and still talk about, and you can still connect it to the reason why you're wanting to pursue this health profession in some way, right? There's always a way for you to sort of put your application and who you are and what you're passionate about into why you want to become a doctor or a physician assistant, right? So don't just hold yourself to only specific like research and clinical experience that feel relevant to medicine. While that's obviously really important and something you want to do, it's totally okay if you still have other passions and other types of interests and experiences as well. Some of these questions I've already discussed, so I won't be going over these frequently asked questions because I feel like I answered them already. But I did want to sort of point out the last question again. So if you're on the fence about medical school or other health professional schools, again, like gain experience, volunteer at the hospital, talk to other students, just sort of do as much as you can to make sure this is something you want to do, just because it is sort of a big investment. In terms of the MCAT, again, you want to consider your timeline and gap years. Do note that the MCAT test, when you take it, it does last roughly 2 to 3 years, and the GRE can last up to 5 years. So that's also something you want to consider within your timeline as well. Great, so with the last 10 minutes, we're gonna go into the Q&A portion of this webinar. So I already see some questions here. So the first question I see is, would you have to take college writing R1A, then English R1A, then English R1B to satisfy the 2 semesters of English, or would college writing R1A and English R1A satisfy that? So just to clarify, if you did not satisfy entry-level writing, then you will need to take college writing R1A. After you complete college writing R1A, this class also satisfies reading composition part A. So after completing college writing R1A, then you would take a class such as English R1B. So for the 2 semesters of English, you only have to take 2 classes. So either it's the college writing R1A 6-unit class, or it's a part A reading composition class that's 4 units. And it doesn't have to be English R1A, right? It can be Scandinavian R1A, it can be Asian American Studies R2A, African American R5A, that's totally fine. And then the second semester would just be the part B. So African American R5B, film R1B, those are all fine. So just 2 semesters. And the way you can sort of know is if it has the R1A, that's the first part, and the second part would be the R1B.
Also, it doesn't necessarily have to be R like R1B. Like I took an R4B class, and I know people who take R5B that also satisfies like the semester as well.
Yes, exactly. Yeah. So as long as it's the R and like the B or the A, like that is a reading composition class, and that will sort of satisfy the English requirement. Great. The next question is, would 1 semester of stats also count as 1 semester of math? So 2 things to consider is the major that you're thinking about. I mean, if that requires, and what they require, some require 2 semesters of calculus. Sometimes they require calculus and statistics, so you want to think about that. And then for the health professional school, they will often denote if it's 1 semester of stats and 1 semester of math. So definitely take a look at the Career Center link that we sent, and sort of consider what they're requiring. Tanvi, what sort of math sequence or quantitative sequence did you take?
I took Math 10A and then Math 10B, which fulfilled like both calculus and statistics, because in high school I did take like calculus and statistics before, so I thought so it wasn't too bad for me. Yeah.
Okay, great. Yeah, perfect. Thank you for answering that. So hopefully that answers your question. This session is being recorded, so I will be sending it out as soon as we're able to. So take a watch out for that email. It'll probably come out sometime next week. So yes, it is recorded. Another question is, if you have not taken the entry-level writing assessment, does that affect which English class you have to take? Tanvi, would you want to answer this question?
I don't think so. I think I did take, I don't think I took the entry-level writing assessment, but I just took an R1A class coming in, and then I took an R4B class the following semester.
Yeah, so it really depends on if you've satisfied the entry-level writing requirement yet, right? There is the Berkeley writing assessment that you can take. If you didn't take that and you still haven't satisfied entry-level writing, that would mean you would have to take college writing R1A, because college writing R1A, which is 6 units, satisfies both entry-level writing as well as reading composition part A.
Yeah.
And if you, oh, sorry, go ahead.
I think there was also, yeah, one of the requirements was like depending on your like SAT score, you could fulfill the entry level by that too, or something like
Yeah,
that.
so so there's a lot of different ways. So SAT, ACT, AP exams, those are all different ways in which you can sort of satisfy entry-level writing. So definitely review the LNS degree requirements. I believe we put that link in the chat as well. So review that because it has a list of the exact scores that you need. In terms of the scores, if you've taken it, you should be emailed, or you should be notified via email. So just watch out for that email. And hopefully we find that before phase 1, so that'd be great. It looks like there's a question about the 4 chemistry classes. Tanvi, did you want to re-explain that for pre-med?
Yeah, so the 4 chemistry classes, I would say like fulfill from Berkeley would be like Chem 1A and the lab for that. And then Chem 3A and Chem 3B, which are the 2 organic chemistry labs and organic chemistry classes. And then the 4th one would just be like biochem. That would also fulfill the like 4th semester for chemistry. Yeah, Chem 1A, Chem 3A, Chem 3B, and the labs with those classes, and then biochem.
Yes, and then for biochem specifically, I believe there's 2 biochem classes. There's MCB 102, and then there's MCB C100A, I believe. So depending on sort of the major you're considering, sometimes you're required to take one or the other. If you're not majoring in one that doesn't necessarily require either, then you sort of have the choice of which one you'd rather take. Great, so we only have about 3 minutes left, and I sort of wanted to leave one last question for Tanvi. I guess if you had any tips for students on the pre-health track, what would you tell a first semester student?
I would say definitely get involved in on-campus like clubs and organizations. I think that's one thing that I not necessarily like, regret doing, but I wish I did sooner because I only found out about a lot of them my sophomore year, and I wish I had joined those earlier. So I'd say definitely join like clubs because they also have a lot of people that are doing the same thing as you and like kind of support you, and they'll be taking the same classes as you. So join clubs that you're interested in general, and also join clubs like that are related to like the health profession that you're thinking about going into. They kind of provide like a good support system also for people going through the same thing as you.
Yes, I 100% agree with that. I think finding community at Cal is really important, and just finding like-minded folks. I definitely agree with that. And then one thing I'll add is, don't be afraid to ask for help, right? Like this process could be really hard and grueling. And on top of just taking difficult classes, you're still adjusting to a new environment, right? Like you are meant to be here at Cal, and we want you to be here. And we want you to have a good time, but we also know it can be difficult at times. So if you're struggling with anything, don't be afraid to ask for help, whether it's tutoring. Like there's a lot of different tutoring resources for a lot of the health professional prerequisites like math and science. So definitely reach out to tutoring. If you're having any troubles with mental health, reach out to your advisor, reach out to Tang Center. There's so many different resources out there, and we want you to succeed. So don't be afraid to ask for help, all right? Okay, was there any other last minute suggestions, Tanvi, that you can think of?
Yeah, definitely like go to office hours, like don't be afraid. Like everybody's there to help you, especially like GSI office hours. They're really helpful because they're like kind of students like us and they're like very similar to our age. So definitely take use of that. And yeah, like it's not too bad. I was really nervous when I was first coming in, but I think you get adjusted pretty quickly.
Great. Well, thank you so much for all that advice, Tanvi. So that concludes our summer webinar. Thank you all again for attending. Again, if you have any further questions, feel free to reach out to your FPF academic advisor. We will be sending out this recording very soon. So again, thank you so much for being here. Thank you, Tanvi. You are amazing. And you all have a great rest of your day, all right? Thanks. Bye, everybody.